here. It is with great pleasure and excitement that I welcome you to the Girl Talk Show, every ladies gist corner. Oh yes.
Yeah.
This is a show where we discuss everything woman, ranging from relationship, lifestyle, self-care, love, you name it, we got you covered. My name is Mary Emmanuel, and yes, today's edition promises to be hot, excited. Hey, did I say excited? My dear, it's gonna be exciting. And I have with me the very beautiful, girls that have their names begin with M. Just so fine.
Well,
I got Maggie.
thank you so much.
Yay! I'm even excited than you said.
So you plan, you plan to come and give it hot.
Yes.
That's why you came looking like a bag of dollars.
Oh my God!
Spicy hot red jumpsuit,
Take a look at the lips.
the makeup, the sassy.
Oh my
long
God,
hair.
baby, thank you.
Oh my
You're
God.
making me
Got
blush.
it. Give it.
By the way, you look good,
Thank you.
girly, pinky. I mean,
Yeah,
I love your
my
shoes.
16 is coming up, so I'm planning for the sweet 16 birthday with the pink.
Sorry, that means you'll be 16 years old, right?
I didn't exactly say that, but I'm just trying to say that, I'm planning to have a sweet 16.
Okay. So there's this thing that ladies always do. They never get old.
Well, kind
Yeah.
of old.
You're always saying, I'm 16, I'm this, I'm that. Hey, age is a representation of how much you have spent on earth. Be proud of it. I'm going to be 40. Yay! It doesn't sound sexy though. I'm going to be 16.
No matter how young you'll be down there, we still tell you.
Now let's go over to the business of the day. Rather talking something really serious. Oh yeah. So I'm gonna be serious now. Let me activate my serious self. That's it. So today on Girl Talk, we will be discussing about how to properly take care of the vagina, the do's and don'ts. So basically, is vagina care. Now, vaginal hygiene is an all-important aspect of women's health, and many women have questions about how to properly take care of their vaginas. Now, especially with the advent of vagina creams, tighteners, soaps, and whatnot. So we had a one-on-one talk with a medical personnel, and this is what she had to say about vagina care. Do take a listen.
So, looking at this pictorial representation of what a vaginal vulva is, the outer part of this place is in between the thighs of a woman. You have the vulva, which consists of the clitoris, the labia minora, and the labia majora. These are, we call them the anterior lips of the vagina. While the vagina is, when you go beyond this point, you are going inside. This is when you talk about the vaginal walls, you're going inside. So when you are washing, we usually recommend, medically we recommend, you wash the vulva with a mild soap, not the vagina. Because when you go beyond washing this space here, and you go beyond it to wash the vagina, that means you're calling for problems like bacterial vaginitis, chronic inflammatory diseases, and also it has a way of killing the normal flora of the vagina, that's the pH level, which is not recommended. So when you're washing the vulva, you use a mild soap to wash this area, wash the clitoris. There's an anterior lip and there's which is the labia minora and the labia majora. So you wash here, you open the inside, like the lip of the vagina, that's the minora, you wash it with a mild soap. Recommend the use of washing the vulva with just water, not the vagina. When you say douching, let me start by douche. A douche is a device you use to introduce water into the body or the vagina. Now, when you are doing a vaginal douching, you're actually introducing a water or a chemical, a solution into the vagina to wash the area. Now, this is the vagina. This is the vagina, the inner part of this area, the inner vagina. So you are douching, you are introducing water inside. You might use a spray, some get a container, fill it with water, and then introduce it inside here to wash. Medically, we don't recommend douching. If you're doing a douching, it has a way of introducing infection from the lower genital tract, this area, this is the lower part of the genital tract, into the inner, the inner end of the genital tract. Now, after the vagina, you have the cervix and the uterus. When you are washing here, when you are douching this area, if there's any bacteria around this area, there's a tendency of, we call it ascending infection, bacterial infection. It has a way of ascending from the lower genital tract towards the cervix and then to the uterus, which can lead to pelvic inflammatory disease, bacterial vaginitis, like I said before. And then when it gets to that higher end, it causes a whole lot of harm to the woman's body. So we don't recommend douching. And even recent studies too have confirmed this. So we don't recommend douching for women. Okay, so secondly, when you're cleaning your anus, we usually recommend cleaning from this part downwards and not from the lower part to the upper part. Now, when you're cleaning from here to this region, whatever that is here, there's a tendency of introducing it to the vagina. So when you want to clean your vulva and your anus, you clean from here down to this region.